So the third most common cause of low back pain and sciatica is your SI joint or comes from your pelvis. So 5C on your sheet there is SI joint or pelvic problem. Let me explain what that is. So first of all, with the other ones we described kind of an age range that we usually look for. With your SI joint or a pelvic problem, we see that in anyone who's 9 to 99 years of age. So pretty much anybody, and it's very common. So what is your SI joint? Let me show you on the model here. So this is a model of your spine. This would be the front of the body. If we turn it around, we can see the back. Your SI joint is simply a joint between the bottom part of your spinal column or your sacrum and your pelvis or your ilium. So SI, sacrum, ilium. You can see the joint a little bit better from the front. The line right there is the joint line. So if I bend forward, I gap that joint. If I bend backwards, I compress that joint. So with an SI joint problem, we see pain a lot of times with bending backwards. Unlike stenosis or degenerative disc disease that we talked about, where you have pain in standing that goes away with sitting, typically this increases with sitting because as you sit, you're sitting on this bone right here and the weight is transferred through that joint. So if that joint is inflamed or irritated, sitting will actually increase this. Other things that we see pain in this joint with is going from sitting to standing or getting out of bed, things like that. That too. So a lot of times, but not always, mechanism of injury of this joint is somebody falls, okay? So if you fall and you land on your butt, you land on that bone right there and it jars that joint, okay? If we look in the back, we talked about the different levels of the nerves that come out that make up the sciatic nerve. So you can see how close the relationship between that joint and some of those nerves are. So sometimes you can get some sciatic pain from this. However, what we typically see is pain right there. So somebody will come in and they'll say, yeah, it hurts right here. It's usually one side or the other, sometimes both, but usually just one side, kind of like in Melissa here that I did that example with. And the pain a lot of times will wrap around the front, sometimes down into the groin, sometimes into the thigh. So with typical sciatica, we see the pain runs down the back of the leg. With an SI joint, sometimes it's a little bit different and it wraps around the front, maybe into the groin a little bit, sometimes down the thigh a little bit. So that's an SI joint problem. Very common. We see it a lot. And just like the example and the demo I did on Melissa up here, we can correct that pretty fast. So with Melissa, she had pain right there in that spot, pain with sitting, transferring from sit to stand increases pain. I did that little bit of hands-on technique that we talked about, and her pain went away pretty fast. Also with that, her motion improved. So pretty cool.